Welcome back. In your morning medical news, the U.S. could face millions of measles cases if state vaccination rates decline further. That is according to a new Stanford-led study. It estimates the rates range from about 88 to 96%. That's below pre-pandemic levels. Misinformation about the vaccine is spreading in this country. So is the disease. The CDC reports 800 cases this year with a hospitalization rate of 11%. Amy Kiley reports.
This is an extremely contagious disease.
A new study shows measles could become endemic in the U.S. if vaccination rates don't improve. That means it'd be present constantly, despite its declared elimination in 2000. Over a 25-year period, the researchers project almost 900,000 measles cases if rates stay the same. They forecast about 11 million if vaccinations decline 10%, and more than 51 million if they drop by half.
Everybody go get the measles vaccine right now.
The measles shots most people get as children are proven to be highly effective.
I believe in the MMR shot.
But U.S. vaccination rates are down since the COVID-19 pandemic. The CDC reports outbreaks in West Texas and surrounding states, with some cases in other areas.
There are complications including pneumonia, including seizures, including permanent disability, and of course, death.
A group of public health experts is trying to raise awareness with the Vaccine Integrity Project. They say it's a response to mixed messages from Health and Human Services Secretary Robert F. Kennedy, Jr.
People get measles because they don't vaccinate. They get measles because the vaccine wanes.
The CDC considers the modern vaccine lifelong protection against the measles. Here's the FDA commissioner on whether parents should get it for their children.
Any child who dies from a vaccine-preventable disease is a tragedy.
The CDC recommends children get their first dose of the measles vaccine when they're 12 to 15 months old. It says they should get the second between ages 4 and 6. That gives an estimated 97% immunity from the disease. Of course, any vaccine concerns, you can speak with your doctor. And the FDA has paused a program that tests the quality of milk and dairy products. An FDA spokesperson confirmed the proficiency testing program is on hold, but it is expected to resume soon. In the meantime, though, state and federal labs will continue analyzing food samples to ensure milk stays safe. The pause comes as the Department of Health and Human Services, which oversees the FDA, makes significant cuts under the Trump administration. Social media appears to be losing some of its luster among the younger generations. 48% of teens say online platforms have a mostly negative effect on their peers, according to a Pew Research Center survey. That's an increase of 16% compared to 2022. Just 11% say social media is mostly positive for young men and women. 44% of teens also say they're now spending less time on the platforms and their smartphones in general. Good idea there. And if you're looking to dispose of some old medications, the Vernon County Sheriff's Office is hosting a drug take-back day tomorrow. You can drop off your prescriptions, pet meds, creams, and more at 4 locations that you see on your screen. That'll take place from 10 a.m. to 2 p.m. And a reminder for you that illegal drugs, needles, and liquids not in their original packaging will not be accepted. Those are those locations again for you.